Hi, I'm Susan Raff, and welcome to Real Talk. We are talking about healthcare today and the fact that people in this country are sicker probably than ever. And yet, as Americans, we're spending trillions of dollars on healthcare, and everyone is looking for a solution. I'm not sure we're going to find the solution today, but I want to talk to Tom Lawry, who has written several books and speaks about our healthcare system being broken and ways that we can empower ourselves, perhaps, and get healthier. So, thank you for joining us on Real Talk.
My pleasure, Susan. Thanks for having me.
So, forgive me, but you're a techie, right? You worked at Microsoft and you've
Yes.
done a lot with AI. Give us a little bit of your background.
Well, yes, I am a recovering Microsoft exec. I spent 15 years at Microsoft. My last role was National Director for Artificial Intelligence for Health and Life Sciences, which, yes, I guess that does make me at least a little geeky. Um, but I've had the privilege of being in and around technology applied to health and medicine for close to 20 years. I'm not a clinician, but I've spent a lot of time working with clinicians and how to apply various technologies, including AI, to make those clinicians better at the things they care about.
We're still learning a lot about AI, and I know states like Connecticut are trying to figure out laws because of the fact that it offers so much potential, but there are also some drawbacks. Talk to me about your focus on AI and how that can help our healthcare system.
Yeah, well, to your point, the beauty of AI is that done right, and I always emphasize done right, it has the ability to basically augment and extend all of the skills of those humans that are doctors, nurses, and others to be better at the things they care about. Anytime I hear the conversation, either the conversation or there's still articles being printed around, maybe we should be training fewer radiologists because AI will replace them. That tells me two things. One, it tells me they don't really understand what AI is good at versus humans. And two, they probably don't really understand what a radiologist actually does. It gives us the potential to basically have a technology that allows us to rethink and change the way we work, to change clinical practices. But it's always about the idea of coming in and behind those humans, those clinicians, to make them better. As to what's happening in Connecticut and what's happening around the world, as far as figuring out what to do, that's the conversation that I refer to as we need both gas and guardrails. We need to step on the gas to be better at all those things that we can be better at when it comes to healthcare and clinical decision making and treatment options. At the same time, we need guardrails. And if it's too heavy in one direction, then eventually that has the potential to cause harm. So the guardrails should include what we call responsible AI principles. So one of the key things we're already seeing is many of the biases in the real world of health and medicine, and there are plenty, are crossing over into the digital world through things like algorithms. Now, the good news is we have lots of tools to be able to predict and mitigate those biases. It's much easier to predict and mitigate bias in an algorithm than, frankly, it is in humans. So we have the tools, but a lot of it starts with awareness on the part of leaders, policymakers, and getting that balance right is really what everyone's trying to find.
So it sounds like you don't feel that AI should necessarily replace humans, but work alongside them.
Absolutely. And again, if you look at the process and the practice of medicine, or you look at what nurses do on the front lines, whether it's a med surg floor, the operating theater, there are certain things that maybe can be automated. So one statistic here in America, which contributes maybe the conversation we're going to get into, is studies show that many physicians spend more time doing paperwork and administrivia than they do seeing patients. There's another study that suggests that up to a third of all activities done by doctors and nurses could be automated with AI. These are not the high level things that these people were trying to do. These are the low level things that are chewing up their time, that are making them drive home feeling more burned out, less excited about being a doctor and a nurse. So imagine going to physicians and nurses and saying, what if I could give you a third of your time back? That's the
To have
promise.
more
That's the
time to
value
spend with their
proposition of AI.
patients. To have more time to spend with their patients. So there
Absolutely.
are benefits to AI. We just have to figure out what role it plays and how we can support it and encourage it, but also at the same time apply guardrails. You've
Absolutely.
you've spent a lot of time in your books talking about our broken healthcare system, and we hear all the time. I cover the state capitol, and they're always looking for ways with pharmaceutical drugs and how we can do that. What do you think are the contributing factors in our broken healthcare system? Are we, as Americans, getting sicker and need all that medication, or is that something that we just need to take better care of ourselves?
And the answer is yes. Um, um, I mean, I'll pull back to your question. When you look around the world among developed nations, Americans are the least healthy people in the rich world and the most likely to die early. The richest men in America live longer than any human on the planet. The poorest have life expectancies comparable to men in Sudan and Pakistan.
That's insane.
Well,
Well,
I could go
considering the
on, but
country that we're in, right?
one other that's very perplexing, and it really is almost the focal point to have everyone say, why is that? Maternal mortality rates in America for women are worse than most third world countries. And what's even worse is maternal mortality rates for Black women are 3 times higher.
Right.
There's no scientific evidence as to why. And
Well, I think there is a little bit of belief that especially women of color, minorities, don't have the access to health care
yeah,
that their white counterparts have.
well,
And
yes,
so,
and
yeah,
that's where the science doesn't have any evidence to say why there would be differences. So you have to start looking at the systemic, access to care. And what I was going to point out is that track record on maternal mortality rates for Black women is worse today than it was when we started keeping records in the early 1900s, which were not exactly the halcyon days for women or Black Americans. So it starts teeing up questions around why is that? There's the science, and then there's everything that you just suggested that we should be looking at and talking about when it comes to, is this acceptable? And the beauty of most of these things is we have the ability to solve for those problems.
who does it better? Europe, is socialized medicine a better alternative? Does that
So
have a better outcome?
I would probably pull out the socialized part, but if you just look, so again, I'm a nerdy data guy. There's a great organization called the Commonwealth Fund that do a longitudinal study of comparing, many factors when it comes to health systems in developed worlds. The Commonwealth data shows America spends 3 times more per citizen than any other developed country, and yet we usually rank dead last on quality, access, outcomes, and effectiveness. So to answer your question, and again, I've had the privilege of working in Europe, in the UK. I just came back from Australia a month ago. And I can tell you, I've never seen a country that I can point to and say, they got it all figured out. There are always challenges. The challenges here in America are things like we're the only developed nation that does not have healthcare as a right. And so to your listeners, the question of the dialogue for citizens that we need to have more of is, do you believe healthcare is a right? Number one. Number two, if you say yes, then the real and deeper discussion is, if it's a right, what should be a right, and what should be the access for the kind of services people have access to? So we start teasing those things out.
I think that you hear all the time, no system is perfect, right? And so in countries where they have socialized medicine, some wait very long time
Exactly.
for a doctor. But I think for basic health care, when it is a right, and you have access to it, you're apt to go more often. When you have high copays and high deductibles and high premiums, I think that can be a discouraging factor. Agree?
Absolutely. And the data also proves that, Susan. And so um, today, 43% of all Americans are or underinsured.
Wow.
What's the number one reason people file for bankruptcy in America? A, they go to Vegas. B, they spend lavishly. Or C, they or someone they love get sick. And the answer is, unfortunately, C.
Right. I have heard that many times. In fact, I've met people over the years who, for one reason or another, they've let their health care lapse or they don't have really good health care, even Medicare. And I have friends who are on that. There are things that Medicare doesn't pay for. So if you go without, without, or you go into debt. So what's the answer? I mean, how do we make this a better system? Put you on the spot there.
Well, I'm parsing so I can give you a succinct answer. I mean, some of it is, and it's part of my new book, Healthcare Nation. We as citizens need to take back our right to help determine our health, the health of our community, and the health of our country. I think many times there's something that I talk about, which I call healthcare fatalism. The system is so bad, the system is so complex, so many citizens just say, yeah, well, what can I possibly do? And, I think it starts by saying, we all have the ability to do something, to take micro actions. And in my latest book, I start the preface by telling the story of Rosa Parks. It's like when Rosa Parks woke up the morning she made history and having breakfast, did she think it was just going to be an ordinary day, or did she contemplate something as she stared into her coffee cup? And what we know is, that one single person, single action became a flashpoint that led to the Civil Rights Act of 1964. And, in my talks and my writing, basically, I'm out there saying, healthcare needs a Rosa Parks moment. When we as citizens spend more time defining what we want out of the system and start articulating it, that I believe is the starting point for change. It's like when enough of us say we've had enough, that's where people in Washington and others will start paying attention. But we have too many people that just, saying, well, what can I do? And then finally, I want to go back to a couple of months ago, the cold-blooded murder of the CEO of United Healthcare on the streets of New York. As tragic as that was, the response online to social media, people were celebrating it. They were overjoyed, and it's part of the cyclical thing of
It's
what
a
I call
sad
America's.
commentary, but it comes from a feeling that many people have of disgust and
Absolutely.
anger in the healthcare system. But one of the things that I find really interesting is that, uh, access clearly is important. And yet we know more about health in a sense than we ever have, right? Growing up in the 60s and 70s, we didn't talk about gluten and carbohydrates. And I didn't know anything about food. I just knew we ate Pop-Tarts. So,
And Wonder Bread.
yeah, and Wonder Bread and all these horrible things. But we know more about food than we ever have. So we are more educated. And yet, what's in our foods is probably contributing to our sicknesses and illnesses. Would you agree with that? I mean, we hear a lot about that
Yeah, and
now.
I think what you're teeing up
Food
is it.
coloring
Yeah.
and artificial and all kinds of hydrogenated oils and all of this, the food. I mean, it's very hard to even navigate through the grocery store today. And now we're learning that some of the things that are allowed in this country are not allowed in Europe. And is that a factor?
Well, I think again, the science shows the answer is yes. Um, it brings us to the whole thing of preventive or proactive ways in which we might look at all things, not just waiting until someone is sick, when it comes to managing our health. And so, the additives is one of a large component of things on the positive movement of food is health. How does food relate to, once again, our health? And whether it's the additives, whether it's the dyes, whether it's the propensity of taking in way too many calories for, your daily activities.
Right.
I mean,
You are what you
today,
eat.
yeah, today 4 out of 10 Americans are obese. And before I go any farther, it's like obesity is officially a real disease as determined by the AMA, the World Health Organization. So this is not about shaming anyone. It's to
I
say,
I heard recently, and I don't know if you've heard this, that, more and more younger people are getting cancer. Cancer used to be something that people in their 50s and 60s got, and now we're seeing younger. And I was reading that part of that might have to do with the fact that if you are obese and you have more fat cells, that helps fuel the cancer cells. True?
well, first, yeah, 20% of all US children have obesity today. Obesity, in many ways, to your point, is what I call a gateway disease. It increases the propensity of so many other things happening with that person as they age and go through the various stages of their life. And I mean, it's a great example. Today, the average child in America spends 7 hours a day in front of a screen for entertainment, not education, for entertainment a day.
Right. I
And
think that's the big
um,
factor. We may have gotten away with Pop-Tarts in our youth, but we were not sitting in front of a screen for 7 hours.
no, I mean, there are a lot of factors moving us in the wrong direction, particularly when it comes to the health of our children. Things like many places these days don't have, access to open spaces. Many people, particularly in urban areas, live in food deserts where it's very hard to have access to nutritious food.
Or they
But
buy it at the Dollar General.
Yeah, but the convenience store on every corner, for $3 you can get that big gulp and a hot dog. And again, these are all the parts of the conversation to me when it comes to us reimagining health and healthcare in America. It's not just about what happens in a hospital, a doctor's office. It's that macro approach to what do we believe is important. And you're teeing up something that's huge, which is, how does food relate to our health, whether it's the additives, whether it's I always look at back to children's health. If you want to know what the box office favorite's going to be for kids, you just need to look at the advertisements of the fast food companies who are not using food, they're using other things to pull kids in.
And I think the other part of this too is the huge dependence on medication. Now, I'm not saying that, I mean, modern medicine is wonderful and it allows people to live longer perhaps than they ever would have. But you can't just rely on medication. And I think we as a society have done that. And several people I know take multiple medications. So rather than diet and exercise and being a little more informed about what they're doing to put into their bodies, they take a pill. And you can't help but not watch television these days where every other commercial is really about medication. I think the downside, obviously, are some of these side effects. But I think that's part of the equation that we rely on medication to get us through. And we need to do a better job avoiding that medication in the first place, if we can.
Well, yeah. American healthcare runs on what's known as a break fix model. American healthcare only makes money when you are sick or injured and we get to do something. So it's all about pills and procedures. 97% of that $4 trillion goes to taking care of you once you're sick or injured. Only 3% of all the money we spend goes to prevention. So to your point, the American healthcare system gets to charge for every pill and procedure, but our ability to do something like 6 out of every 10 Americans have at least one chronic condition. 75% of all of that money goes to treating them. And yet 80% of chronic conditions are preventable. So let's
Wow.
just play that out for a little bit. And back to your thing about all the pills your friends are taking. Pharmaceuticals are extremely important when it comes to managing many things. But the question for your listeners and others does it make sense that we spend more than any other country in the world, our health status is the worst? And part of that's because we wait until you're sick or injured to do something. Again, 97% of all the money we spend goes to fixing things, only 3% to preventing. I mean, does that make sense? And where would you and others stand when it comes, if you had the ability to rebalance that? That to me is part of the discussion that we all need to be having when it comes to, it's our money, it's our health, and we deserve to have our hand on the steering wheel to do more to drive us to a different direction.
I'll give you an example of that. Connecticut has gotten better, but they don't have, some hospitals still don't have full-time lactation consultants. So when a woman gives birth, and breast milk has been shown to be extremely beneficial for babies, especially those who are born premature. And very helpful for the mother as well to recover. But that's preventative, and they don't have that in the hospital. So if you're not getting that prior, then you're not really getting the care that you need after. And whether it's diet, I think that we don't spend enough on preventative. It's, as you said, we wait till it's broken and then we try to fix it.
Well, we could spend a whole 30-minute segment just talking about the disparities in women's health compared to men, but you're absolutely right. And it's a great example of all the things we can do that cost little, that really support people in managing their health and managing the situation through childbirth, through those early years of getting your kids off on a great start. But again, women's health in America, there are great disparities. I'm not sure why we're not spending more time talking about it. I saw a study the other day that shows we spend 5 times more trying to figure out solutions to erectile dysfunction than we do for PMS. That alone opens the door to say, is that the right balance?
Right. We're running a little bit out of time, but before I go, I think I want to focus on some of the controversy surrounding Robert Kennedy Jr., who is the health secretary now for the Department of Health, who has focused on what we're eating and some of the things that we've talked about, but some of the controversy over the vaccines. And, it's been a long time in my memory that we've talked about measles, and now we're seeing, hundreds of cases. We've seen a young boy die. What do you make of that?
Well, first of all, let's agree that the appointment of RFK Jr. is a lightning rod. We'll just put a period there. Second, measles is part of the broader discussion of vaccines, which has been kind of raging since COVID kicked in. I mean, my view is, I guess, a two-parter to your question. One, when it comes to vaccines, not in any way in defense of that appointment, but if you look at the data and the science, vaccines, all drugs, even when they're FDA approved and they go to market, they have risks. And you said it. Think about all those commercials you hear at news time, where if it's a 60-second commercial, what percentage of that is that commercial telling you all about the risks of taking that drug?
Well, we saw that during COVID. I mean, by and large, the COVID vaccine saved a lot of lives. Were there people who had some issues and didn't respond well? Yes, but very, very small in comparison to the larger group.
There's risks to any human-made pharmaceutical. People need to be aware of that. But beyond that, yes, the benefits, when properly applied and administered, are clearly greater than the risks. The second part of that on RFK, to me, it's a great example of how we as citizens disempower ourselves. Everyone's focused on, that appointment. And it shouldn't be what RFK Jr. thinks about food safety. It should be about the conversation we're having, where every citizen should be looking at, well, what does this food issue have to do with my health, and what do I think? The same with chronic conditions. So I always turn that around to say, the good news about RFK Jr. is he's teed up 2 important things: chronic disease and food safety. It shouldn't be about what RFK thinks. It should be about, what do we think? How do we start using our voice to say, here's the direction we want to see food safety go in, food as medicine go in. Here's what we want to start doing, demanding when it comes to how we hopefully prevent and then manage chronic disease rather than saying, well, we're just going to wait until someone has chronic disease and then we're going to start charging for all those pills and procedures. I don't really care what someone like RFK Jr. thinks. What I care about is what everyone listening thinks and how we start mobilizing to have some way of saying, it's not about his voice, it's about yours.
Tom Lawry, this has been a very interesting, insightful conversation. I hate to use the words interesting. That sounds too blasé. But I think that the takeaway here is that nothing is a panacea, right? And so we need to really think about what we're listening to, what we're doing to our bodies, and find that healthy balance. And no one has all the answers, but hopefully after listening to this conversation, people will think a little bit more about their health and how they can be healthier.
We have the ability to be better and do better, but thank you for having me on.
Thank you very much. And I hope you'll come back on Real Talk. It's been great. Thank you so much. And thank you, everybody, for listening and watching, and have a great day.